This last year and a half of our lives has changed every facet of the way that we work, particularly for those of us in healthcare. It's been very difficult. And the light at the end of the tunnel will be when we reach this herd immunity. And that can happen much more quickly than the virus running through the population if we receive the COVID vaccination. And for those of us that are in healthcare, I think it's particularly important because we're taking care of an at-risk population. And if we can do anything to make it less likely to give COVID to our patients, I think it's very important for us to consider that. At the time when I received it, it was very early, and I received it as soon as I could. And at that time, the data out there is we were looking at the vaccine after it had been administered to about 30,000 patients. And I still felt like, even though that was a relatively small number at the time compared to how many have received the vaccine now, looking at the data and the statistics on that, I felt that it was very safe. I felt like if there was anything that I could do to help prevent the spread to my family or to my patients, I felt that it was very important. And I also looked at the efficacy of the vaccine, and we're finding that it's not perfect, particularly with the Delta variant. You can still contract COVID, but the chances are much lower. For our very sick patients that have COVID right now, that are in the ICUs, that are on the ventilators, 90% of those are unvaccinated. And for other patients that are sick too, sick enough to be in the hospital, 80% of those are unvaccinated. So when we look at our vaccine statistics, when we look at our hospitalization rates, and for those that have severe disease, it is much lower than when you're vaccinated.